Hi, I'm Neda, Assistant Professor of Health Policy at Evidence-Based Medicine Research Center in Tabriz University of Medical Sciences in Tabriz, Iran. In this short video, I'll share how integrating patients' experiences enriched our clinical practice guideline adaptation process. I believe that useful evidence for policymaking not only comes from clinical trials and systematic reviews. Of course, there is another source of evidence, which is patients' experiences and patients' voices, how they navigate care, what works for them, and where system fails. In our recent guideline adaptation project, we decided to not solely rely on quantitative data. So we conducted a systematic review of qualitative studies, and we extracted patients' experiences and patients' voices and integrated these insights to our final adapted guideline. I think this approach made our recommendations not only more evidence-based, but also more human-centered and more practical. In other words, when health policymakers and healthcare providers decide to not solely rely on quantitative data or use qualitative patients' experiences and voices alongside the scientific data, their decisions become more practical and more fair. For me, this was a true example of collaborative knowledge communication, where researchers, policymakers, and patients engage in a soul dialogue. And I think evidence communication is not only share what we know, but also understand what people experience and what patients experience. And again, I think this is when evidence becomes truly in action.